Hey everybody, this is Dr. Matt Joosse at Joosse Family Orthodontics in Williamsburg, Virginia. Wanted to show off this amazing case. It really demonstrates one of the reasons why we like to see kids early, usually by age 7 or 8. We like to see kids at age 7 or 8 because sometimes there are situations that require us to get involved and be able to use the growth that's happening in kids' bodies to really be more effective. And this is a perfect example. So as you look at Joey, you might see some spaces between the upper teeth, and the spaces actually look a little bit worse than they are because one of his front teeth up here in the upper right is not yet in the mouth. But nevertheless, he has a big space between the upper two front teeth. And you can also tell if you're looking closely that he has an underbite. So the upper front teeth are behind the lower front teeth. Underbites are things that we like to treat early for a variety of reasons. One is because a lot of times when people have underbites, it's because the size of their upper jaw is small relative to the size of their lower jaw. And at young ages, age 8, 9, 10 years old, the upper jaw is actually growing more than the lower jaw in kids. So if you can treat them at age 8, 9, and 10, you can make the upper jaw bigger, or you can move the upper jaw forward, I should say, and try to eliminate this situation. The reason why that's really important is because later on, the growth of the lower jaw will outpace the growth of the upper jaw. That happens during puberty. And for kids that have underbites, when that lower jaw grows a bunch during puberty, the underbite may come back, and it may be so severe that it can't be treated just with orthodontics. Sometimes it requires jaw surgery to break the jaw and to actually reset the jaw into a overbite position and not an underbite position. So one of the reasons why I like to treat kids early is to try to avoid jaw surgery later on. And this is a really, really important form of early treatment. Let me show you a little bit more about Joey. All right, here's a close-up of Joey's teeth, and you can clearly see that the upper teeth are behind the lower front teeth. There are some other reasons beyond avoiding jaw surgery about why you want to treat these kinds of underbites early. One of them is that you can see from this picture that the lower front teeth are hitting on the outside of the upper front teeth. And in some kids with this kind of bite, we'll actually see damage to the enamel, the outer enamel surface of the upper front teeth. And once that enamel is damaged, it cannot be regenerated. It cannot come back. You could fix it with a filling material, but it'd be great if you can avoid having fillings on your upper front teeth for the rest of your life. So we want to try to prevent damage to the enamel of the upper front teeth. Another reason why we like to treat these early is because in this kind of bite relationship, the lower front teeth are getting hit every time that Joey bites down. And as those lower front teeth get hit, they're being knocked forward. And that is really bad for the health of the gums. So a lot of times we'll see gum recession. We did not see that in Joey, but a lot of times we see gum recession on the lower front teeth because of this bite relationship. So that's another reason why we want to treat these things early, to try to avoid gum recession on the lower front teeth. Well, how do we treat this? We're really trying to do more than just move teeth. We're trying to move the upper jaw. Here's a picture of how we do that. Now, this is obviously not Joey. This is a stock image taken from the internet, but we use reverse pull headgear, or what we call a face mask. And we ask that kids wear this from after dinner till breakfast time. And the more that it can be worn, the more effective that it will be. But if we can wear it from after dinner until breakfast, typically that approaches about 12 hours. And 12 hours of pulling the upper jaw forward will give a good orthopedic effect. So we're actually moving the upper jaw forward, trying to eliminate the underbite. And we're using the forehead and the chin to pull off of. So obviously the forehead and the chin being bony, we can use those as hard surfaces to pull the upper jaw forward. You can see rubber bands attached from this appliance to an appliance that goes on the upper teeth. And so that's how this works. It's an orthopedic movement, actually moving the teeth forward. Now, in the case of Joey, we also used 4 braces on the upper front teeth, and I'll show you why here in just a minute. But this was the result that we got. Joey was in treatment. He wore this appliance for about a year, and we pulled that upper jaw forward. We did nothing to the lower teeth. So the lower teeth were not touched at all. All the results that you see here are from upper tooth movement. And so that's a combination of the upper jaw being pulled forward using the face mask and some effect of using a few braces on the upper 4 front teeth. But you can see a significant change. Here's a picture of Joey smiling at the end of treatment. And we use the braces primarily to close the spaces and to give Joey a nice aesthetic result. In situations like this, I alluded to this earlier, but we want to treat these cases early and then we want to wait, and we want growth to happen. We want to see what happens to the growth of Joey's lower jaw. We want to see if that underbite tendency comes back as he hits puberty. So Joey is about to be 10 years old, and my plan is to wait at least 4, 5, maybe even 6 years until we do a second phase of treatment. Now, he may not require a second phase of treatment, but I certainly I would not want to initiate that second phase of treatment soon, because at this point we just want to watch how his growth trajectory goes, and we want to see if that underbite situation comes back. But given the gains that we gave Joey, I feel really confident that we're going to avoid any possibility of jaw surgery later. This underbite is probably not going to get so severe that it would require surgery to fix it. I think that we've given ourselves enough of a head start by taking him from an underbite, like you see on the left, to an overbite, like you see on the right, that we can safely avoid jaw surgery in the future. We've also, of course, protected the lower front teeth against recession. We've protected the upper front teeth from having enamel defects. We've also made his jaw joint healthier because he can bite down properly now. And so there are so many advantages to getting this treatment done and doing it at an early age. And Joey was just a fantastic patient. So it's of course really nice to see him smiling more confidently. And I think that that's an important part of this treatment too. Because we're gonna wait several years, because we're gonna wait till he's 15 or 16 years old, if he needs a second phase of treatment, we want him to feel good about his smile now. So if we left him with the smile that he has on the left, for the next 4 to 5 years, I think that would take a toll on him emotionally, and he'd probably be begging for treatment later on. So if we can make it look nice now, and we can just preserve this, then he's got a confident smile, and we've corrected the bite discrepancy that we needed to. So I think this is a fantastic example of good early, what we call phase 1 treatment. And I always say that good treatment requires good partners in treatment. And Joey, my man, you were a great partner in treatment. You wore your face mask really, really well, and you got some amazing results because of it. So thanks so much for being an awesome patient, and go show off that smile, Joey. Thanks so much.